Hello, welcome back to my channel. My name is Megan and I am a first-time mum here on YouTube. I am coming to you with my 25 to 28 week update. I'm currently 28 weeks and 5 days. Yes. So I thought I'd do a little update for you about how the last 3 or 4 weeks have gone and what's happened, any updates that I need to give you, a little bump shot, a little harbler, give you a bump shot. Also, I thought it might be a good video to show you some of the new clothes that we've got for our baby. So I thought I'd start off this video by saying, if you want to, I have 3 previous videos that I've filmed in regards to the pregnancy. This is my first pregnancy. So I filmed a announcement sort of video and my first trimester symptoms, and then I've also filmed I think the other one was a 12 to 16 week, and then you've got a really long update which was my last video, and that was our gender reveal as well. So if you haven't watched those videos, go and watch them first, just because this will make more sense. If not, just continue watching, that's fine. If you want to stay up to date with my videos, please click the subscribe button down below and watch out for more videos, because I'm going to be filming right up until I'm ready to go, and I'm sure that I'll be doing some postpartum videos as well once he's here. So first off, I thought because I wrote down in my notes that to give an update on the whole breathing situation, because in the last video I mentioned that I was having really bad breathing difficulties, and I was sort of having these episodes where I literally couldn't breathe and I felt like my chest was so heavy and everything like that. Turns out anxiety is a thing. So turns out I didn't really realise that it was an issue, but throughout this whole pregnancy I have been quite anxious about a lot of things. The pregnancy was more just normal pregnancy worries, and that it was completely normal, which it is completely normal to get worries throughout your pregnancy. It's just a thing, especially if it's your first one. But they kind of started manifesting into panic attacks, which is where you're kind of yeah, okay, maybe it's not very good. Hi, this is just editing Megan here. I just was to come on here just to say, if you want to skip ahead the appointments, because I do ramble on for about 10 minutes and it's not the most interesting part of the video. If you're interested in the appointments, keep watching, but if not, skip to 13 and a half minutes, and that's where I start talking about the more interesting things and the bump date and all that fun stuff. Within this time that I'm giving you an update, I've had a 25-week GP update appointment, 28-week midwife appointment. I've also seen a consultant, and I've also seen a specialist. Yeah. So I've had 4 appointments that I need to go through with you guys today. So with the breathing difficulties, when I went to my 25-week GP appointment, I mentioned it, and we obviously discussed that we think it's a bit of anxiety, and that my previous counselling service that I've been with wouldn't really be suited at this moment in time, because for me the anxiety is around the pregnancy. It's nothing to do with anything else, nothing to do with any other issues. It's simply around the pregnancy. So she referred me to a service called IPS. Now, some of you in the UK might know what that is, but it's basically it stands for Infant Parent Perinatal Service. I think it's just mental health for ladies who are pregnant, postpartum, and early on with your child. So I got referred to them, and I had an appointment quite quickly, just because my panic attacks were getting quite bad and I was getting them very regularly, so they wanted to see me sooner rather than later. Other than that, in my 25-week appointment they also measured my bump to make sure I was measuring along fine, which I was. I discussed a few other symptoms that I was getting, and they also listened to the heartbeat. So that's what happens in that appointment. It's quite a quick, straightforward appointment, nothing major really. They just do your blood pressure as well, take your urine, all that sort of fun stuff. After that, I had my my assessment with IPS. So that assessment is just basically going through everything, and I mean everything. If anyone's had an assessment in a mental health a clinic or service, you know that the assessments are like full on, really full on. But it somehow made me feel a lot better that I kind of like got everything out to someone about my worries and also about just things in general. So that did help. I've got an appointment on Monday coming up, so she wants to see me every 2 weeks rather than every week. So I had my assessment, and that was like nearly 2 weeks ago, and then I've got my first appointment with them, so I'm under them. But the plot kind of thickens, and I will explain that in a moment. I'll just go through what happened at my 28-week midwife appointment. So in that appointment, I didn't actually end up seeing my midwife because she was in a labour, which is fine, it happens. So I saw a different midwife, and she just, again, measured my bump, made sure I was measuring fine, which I was, listened to the heartbeat, that was all fine, took my urine, and then I also got my blood taken because I wanted to check my iron levels and also the antibodies in my blood because I am B negative. And they also gave me my I think it's anti-B, but I'm not sure if I've got that right. But they basically have given me my shot, which I have to get because I'm a B negative blood type and my baby is a positive, I don't know what type, but he's positive blood type. So I have to get these shots in order to prevent rhesus disease in my child, which is fine. It's basically like a flu shot. It was a bit more painful than a flu shot. I think it was a thicker needle, but that's fine, you know, all for the child and whatnot. I discussed with them like where I want to give birth. They said to me I don't actually do a full birth plan with my midwife until 36 weeks, but she discussed through to me the options that I had, and I kind of discussed what I wanted out of my childbirth. I definitely, not definitely, but I'm pretty sure that I want to have a water birth if I can. I know that these things forever change and like things happen, but that is my ideal situation. I want to be in the midwifery unit at the hospital, and I want to have a water birth if possible, which would mean I wouldn't have an epidural, so I would just be on gas and air and potentially an injection if I needed that extra pain relief support. But yeah, it would be more of a relaxed environment, which I kind of want. But as I said, things change and I can't hold that as my like final plan. So we'll see. I'm going off track a little bit, and I was going to speak about this later, but actually it fits into what I'm going to discuss now, is his movements. So fetal movements, pretty much established a pattern now. I wouldn't say the movements are stronger, they're just different. I think whereas in my last update it was kind of like little kicks, little, you know, just little kicks here and there, whereas a lot of the time at the moment I feel him rolling over and moving, and that's quite common throughout the day, is him moving and nudging me and things like that. That's more what it's like now. Now I've had 3 occasions where I haven't felt him move for a whole day. So at that point I had gone into the MAU, which is the maternity assessment unit. I think I might have mentioned one of the times I went in my last update, and that was one of them. But since then there've been 2 more. And on those 2 more occasions, because I was 26 weeks plus from that point, they measured me, they monitored me. So they put a belt thing around your belly and measure the heart rate over a specific period of time. They also do loads of other things, but I don't know what it does. But you also have a little clicker where you can click if you feel the baby move. Now what I found really frustrating is like he wouldn't move all day, and then I get to the maternity assessment unit and he would move, and I'm like, what are you doing? You're making me look like an idiot. So on both those occasions everything was fine, and obviously they said that the monitoring was absolutely fine, but obviously I'm concerned as to why those couple of occasions he didn't move for a whole day. And I think a lot of people have said to me, oh, it might be him just growing, and I'm trying to like stay calm, and I think that's what it is now. And obviously the anxiety doesn't help, and you think of the worst and everything like that. So on the second occasion that I had been monitored, so if you're monitored any more than 2 times, they will refer you for a scan. They'll request it. So it doesn't mean that you're going to get a scan, but this is my trust anyway. Every trust is different, but my trust refer you for a scan. They request a scan from the obstetrician. I think that's how you say it, and if it isn't, I'm really sorry, but I don't know how to say it. This kind of goes on to, I was discussing this with my midwife in my 28-week appointment, and then as I got out of that appointment, they'd called me, so I called them back, and they basically said the obstetrician, the maternity doctor, I'm going to call them because I don't know how to say it. So they basically said they don't think I need a scan because I don't have any risk factors and I haven't had many issues in my pregnancy, so they don't think I need a scan. They don't think it's going to show anything because my bump's growing fine, so they think the baby's at the right size. But they said that they want me to come in to see them for an appointment with the obstetrician or the maternity doctor. When was that appointment? It was on Tuesday, so literally this week. So I had that appointment, and that's a very different process because I'm obviously under midwifery care, so I'm not used to seeing maternity doctors. It's very different. So it's at the hospital, so you go in and they have a whole room where you give your pee, and it's really, really weird. So I went to that, and they basically just had a big chat with me about how they don't think anything's wrong with the baby, because they had a feel around, his head was down at that point, I don't know if it still is, but his head was down on Tuesday, and I'm measuring fine, the heartbeat's fine, he was moving okay, so everything in that respect seems to be fine. But they kind of want to keep an eye on me and still see me, just in regards to more like the anxiety side of things, because they just want to keep an eye on it and they want to work as a team rather than me just being under midwifery care. They also wanted me to see a obstetrician psychiatrist as well. And I did say to them, I said, I'm under IPS, do I need that as well? And they said, yes, it'd be really helpful because he specialises, I don't know, they just recommended it. So I was like, right, that's fine. I literally this morning got my appointment for them, and they're in early January. So I have those appointments upcoming. They want to see me again at 32 weeks, but they want to see me after I've had this appointment with the psychiatrist. Anyone in the US, that's the equivalent to OB-GYN, I think. It's the equivalent to that, is who I'm seeing. And they still want me to see my midwife as well. So I'm gonna have just like so many appointments going on, but it's fine. They want to like see me all together and kind of come up with a plan and like kind of see what's best for me in terms of childbirth and everything like that, and just a plan for me, which I'm thankful for, that there's a team that want to look after me and guide me through all of this, so I'm very thankful for that. But that's kind of like a really big update, and I'm really sorry actually, like I thought there was a lot less to talk about, but actually there was quite a lot to talk about in this period of time, because I feel like in the last month quite a lot has happened, just because I think a lot more people are getting involved with my pregnancy in terms of professionals, so that is a lot of information. I'm really sorry if I rambled on. Well, now that I've given you that like massive update of like all my appointments and everything like that, I'll go on to like the more interesting bits of the video. So next bit I was just going to talk about is how big he is now, and that what my app has told me is that he is 38.6 centimeters long, which is quite long. That he's 2.5 pounds, which like to me is just mad. Like that is like, I was £6 when I was born, so that's like almost half my baby, like what I was as a baby. So that's just crazy to me, absolutely crazy. And I'm 29 weeks on Monday, and by then he's £3, so it's just like that's mad. That's really mad. So like, fun fact, he is the size of an eggplant apparently, and I don't actually know what an eggplant looks like because I'm from the UK and I don't know what an egg, I think it's an aubergine, I think. Going on to symptoms. Now, symptoms I haven't really had that many of. The only symptoms I kind of feel like are quite normal for this time and like that I've had is just like growing. My belly feels just like really big, which is like obviously because I'm 28 weeks pregnant. Other symptoms I've had a few restless nights. There's been a few nights where it's been a bit uncomfortable to sleep and I can't really get in a comfortable position. I keep tossing and turning, and like I really want to sleep on my back, but like I can't, so it's just like really can be uncomfortable some nights. Most nights I'm okay, but some nights I just struggle a bit more. So I get the bus to work, and that is just a really uncomfortable ride for me, and I hate it because buses are just not comfortable at all. And they're always a bit bumpy and just very long. Like my bus is about an hour, so it's just a long time to be on a really uncomfortable, you know, position. Another symptom I've had, which is actually quite embarrassing, but I'm gonna say it anyway because I mean this is what these videos are for, right? Is that my boobs have started to leak a little bit. Yay! So the thing is, I didn't think this was going to happen to me, and I know a few people on my group chat were saying that they had it, but I hadn't yet. And all of a sudden, literally the day we went out and got loads of stuff for him, oh, what's that? Oh, my boob's leaking. Great. It's happened probably on how many occasions? Probably like 6 occasions now in the last 3 weeks. Yeah, so it's not all the time, but like it will happen. I'm hoping it's a good sign and that my milk will come through, and I'm hoping that that's what it means. But yeah, that's happening. But it hasn't happened while I'm at work or anything yet. It's always in the evening when I'm just chilling. So I guess that's good, but I'm just really hoping it doesn't happen at work. Cravings, I haven't really had any cravings. I've been quite boring this pregnancy and I haven't really had many cravings. The only 2 things I can think of that I've craved quite a lot is I've eaten a lot more chocolate. I started eating a lot more chocolate. Now I like chocolate, don't get me wrong, but I've never been like a massive chocolate eater. I'll eat it, but it's not like, oh my god, like chocolate all the time. But I've been eating more chocolate, so I don't know if that's just me having a sweet tooth. But I also have been craving quite a lot of peanut butter, which is random, but peanut butter has been something I've really craved as well. They're the only symptoms I've had. Stretch mark update, fun times. Okay, so stretch marks, still none on my belly. Yes, touch wood. We're not like, let's try and not get these bad boys on my stomach because I really don't want them. But we don't know. I've still got like 11 weeks until that could happen, so we have time, but let's just hope that they don't come. We'll see. I've been still using the things I've been using that I mentioned in my last video. I've been using them every night, like literally not missing it. In terms of my hips, I have actually got like 3 little stretch marks on my right hip, and I've got like a few little ones on my left hip. So my hips have got stretch marks, quite red ones actually. I feel like my hips are growing more than anything else. Like my legs haven't gotten bigger, my arms haven't gotten bigger or anything, and my face hasn't swelled up yet, but my hips have, I feel like my hips have grown, and I know that that's your body preparing for birth. So I think that that's where my stretch marks have come from. And I've got also a bit of extra water, a bit of extra fat around the hip bum area, which is fine. Like that's okay, I'm okay with that. I thought that I would now just show you a few bits of clothes that we've got for him. And then I will show you my bump. Now, we've been given loads of clothes. by Aaron's sister, bless her. She has a little boy, so she had loads of clothes in the loft that she gave to us very kindly, which we have put in his little set of drawers, and they're all like obviously second-hand clothes. So I wasn't going to show them just because I don't know where they're from and they probably won't be available anymore, so I didn't want to show you and then people are, oh, I want that, and I literally have no idea if it's still available, because obviously that would have been a couple of years ago now. As well as buying some ourselves, we've also been given some new stuff as well, which we're really thankful for. We've got like quite a few of like these like little bodysuits, just sleeveless, bottomless, just really handy like basics, and these were from Primark. Primark are quite good for basics. I'm not so keen on their outfits. Some of their outfits okay, maybe it's just my Primark, I'm not really keen on their range at our Primark, but their basics are really good. So if you need like bodysuits and sleep suits and things like that, they're really good for like basics. So like a pack of these would cost like under £10, like a decent amount of money. I picked up this, I'm hoping that he fits into this because this is up to £7.5. I think it's a tiny baby range, but it's always good to have one of those just in case. But it was only £1 from Matalan, and I loved it, so I had to pick it up. But this is this little wing. This is the outfit that I got to tell Aaron that we were having a baby. So this is his first ever outfit that I got him. I got him. I think this is not newborn, I don't think. I think it's 0 to 3 months, but look how cute. So that's his first ever outfit we bought for him. Fun fact, this outfit I'm just about to show you is the outfit we went and got him after we found out that he was going to be a boy. So we got him, it's like this little outfit. It comes with like the trousers, so it kind of goes together, and a little hat. So much, but we've got loads of little sleep suits, little one with dinosaurs, more dinosaurs, and I think we got a pack in newborn and we got a pack in 0 to 1 month, I think. So we've got loads of them. They're so nice, and these are all from Primark. These little sleep suits, they're so good. I love the little striped one. I think it's really cute. So yeah, they're just loads of little, loads of little sleep suits, which are so fun. And then we've been given like all of these new things which are really nice. So a lady from my work, she actually left a few months ago, but she wanted to give me this before I left, and it's like a little jacket with a little, oh, I love it. And this is from George from Asda. And then we were given some little outfits by his nana, and these are like little just little sets that he can wear. And they got this one too, and there's another one I think, which is this little like jumpery one when it's got an elephant on it. So cute. These are also from George in Asda. My best friend also came up about a month ago and visited, and she bought us a few little bits. Got him a little elephant toy. That's his first toy, so this is really cute. And a little cardigan, which is also amazing. And these are from Arkit, which is like a some of you might not know what it is, but it's a chain off of H&M. It's just like, yeah. So that's pretty much it for the update. That might have been quite a long update just because I know that there was a lot of appointments going on and stuff like that. But I hope you've enjoyed this video. I'll just show you my bump. I'm wearing a very baggy top, so you can't really tell, but I'm gonna show you anyway. Now I have some leggings on. Bump, you can tell I'm getting a bit hefty now, guys. My next video will probably be a 28 to 32 week. I'm going to try keep it like month updates instead of like really long ones. So yeah, and obviously I don't really have any appointments coming up. I've obviously got Actually, that's a lie. I have so many appointments coming up. So I will probably post another video at roughly around when I'm 32 weeks, and I'll do a 28 week to 32 week update. But for now, that is my 25 to 28 week update. I hope you've enjoyed this video. Please give it a thumbs up for me, that really helps, and click the subscribe button down below, and I will see you in my next one.